Tarde, boa tarde, boa tarde, boa tarde a todos. Sejam todos muito bem-vindos a mais uma live rebelde. Hoje uma live rebelde internacional. Vamos conversar com o Doutor Koutnik, que é um pesquisador, biomédico e pesquisador, que está revolucionando, vamos dizer assim, a ciência, porque o último estudo dele literalmente matou e enterrou o o carb loading, né, como é chamado. Deixa eu convidar ele aqui para a gente poder conversar. Pessoal, a live vai acontecer em inglês, tá? E ela vai subir para o YouTube, tá? E lá no YouTube vai ter as closed captions, né? Que vão deixar o YouTube, vão deixar isso traduzido, tá? Então, quem de vocês que quiser ver ao vivo, entendendo o inglês, tá por aqui, estaremos fazendo esse bate-papo. Se não, você pode assistir depois lá no YouTube a live. Então vai ser super legal, deixa só ele confirmar aqui a presença dele para a gente começar. Deixa eu falar aqui para ele. Vamos lá. Enquanto ele aparece, deixa eu falar para vocês sobre o Clube de Leitura. Clube de Leitura, estamos chegando ao final do nosso 7º livro do Clube de Leitura. Ele acabou de entrar aqui na live, deixa eu mandar mais uma vez aqui o convite. Estamos chegando ao final do 7º livro do Clube de Leitura. Ixi, ele não está conseguindo participar. Vamos ver se ele se aceitando aqui. Sometime. Ok, Dr. Koutnik. How are you?
Good. How are you doing?
I'm fine, thank you, thank you. Uh, I heard that you are a Brazilian Jiu Jitsu.
Ah, yes.
Yeah.
So one of my senseis or mentors in jiu-jitsu, his name is Shane. He runs a studio called Black Tie Jiu-Jitsu in Tallahassee, Florida. His mentor is actually in Brazil. Uh, and so he actually runs a spot called BJJ Art Academy, and I think near Rio de Janeiro. So yeah.
Great. You have learned to speak Portuguese.
Oh, not quite. One day, one day.
Okay. I was thinking that for most of my public that don't know you, you can make some introductions, introduce yourself. How did you get in low carb? And I heard that you are also a type 1 diabetic. And I
Correct.
think that I
Yes.
think that's a kind of motivation to do low carb. So if you can tell a little bit
Yep.
about your history for us.
Sure. So I grew up and developed obesity as a kid, mostly due to a diet, not necessarily because I wasn't being fit or exercising. I was exercising quite a bit, but still found myself overweight and obese. And then I was able to finally lose weight through dietary change. But then a year later, after coming down in weight, I developed type 1 diabetes, which is an autoimmune disorder, meaning that the body attacks its own tissues. And the tissue attacked was the tissue that produces insulin, which is the most powerful hormone in all of metabolism. So I essentially became very, very, very aware of how everything in my life affected glucose and insulin. So nutrition, uh, exercise, sleep, medications, all these things would affect how potent the insulin would work in my body. And I knew that nutrition was one of the most powerful ways to change blood glucose levels. And the higher blood glucose went, the higher insulin needed to be. And so there was this intimate relationship between food and insulin. But now I was in total control over the dose of insulin I was going to need to administer. And so as a result, I spent the rest of my life, the last almost 20 years now, of every meal, of every day, every time I go and exercise, thinking about the type, duration, intensity of exercise, and how it affects both my glucose levels and my insulin levels, because now I was in total control out of both of those. And that's why I became so intimately passionate about type 1 diabetes, and not just type 1 diabetes, but food, metabolism, and what goes with that.
It kind of set up your career. Or
Absolutely.
Yeah.
Yeah.
And how this low carb thing that you get into, how do you do your diet, and how is your what the kind of food that you eat, what you don't eat?
Yeah.
You are a kind of nutrition freak that measures everything, or you are a little more relaxed? Because when I was in university, I had a teacher that was a type 1 diabetic, and
Yeah.
he was, I think he is, still is, insulin resistant. That was a combination that I never heard of, because in my mind, a type 1 diabetic wouldn't be insulin resistant. So I understood that he ate a lot of carbs. So he has to inject a lot of insulin and become, even if his pancreas doesn't produce any insulin, he became insulin resistant. So I thought, come on, low carb, it's so much better. So how is your nutrition these days?
So to exactly what you said, the same thing happens to everyone else who doesn't have type 1 diabetes. If they consume higher carbohydrates, they're going to release more insulin into their bloodstream, and that insulin is going to go to their tissue and store fat tissue, store glucose in the muscle, store glucose into tissues like the liver. Oh, the same thing that's happening when I inject insulin is the same thing that's going to happen to someone else who doesn't have type 1 diabetes, because they just don't know it, because they're not monitoring the amount of insulin their body's releasing like I have to in order to ensure that I am controlling glucose levels. But when people ask about low carbohydrate diets, one of the most important things to realize is that these are not new diets. Low carbohydrate and or ketogenic diets have been around for over 200 years, not only for the prevention, but also reversal of things like obesity, diabetes. For the last 100 years, it's been used for certain neurological disorders or brain disorders like epilepsy or seizures. For the last 20 years, it's been used for a number of other conditions, including things like bipolar, schizophrenia, and depression, as a potential therapeutic strategy to help patients with mental health disorders. At least there's emergent evidence that it may support these potential circumstances alongside medications. And in some cases, there's anecdotal reports of people reversing their conditions, which is quite, well, let me say, putting them into remission, where they're able to put the symptoms of their condition all the way down by either medications, diet, or in some cases just diet, which is quite remarkable. But we'll see when we have more rigorous, impressive evidence what it looks like. But in short, it looks like it's a helpful tool across a number of conditions. So it's not a new approach. But when someone thinks about a low carb or ketogenic diet, what they should think about is typically they're reducing sugary, starchy forms of carbohydrates, things like breads, things like rice or pasta. They would be switching away from foods like that to focus on foods that have higher protein, higher fat content, and lower carbohydrates. And how someone may typically make up a ketogenic diet is they may think first they want to build the diet around a protein source. So let's say they want to have fish, chicken, eggs. You can do plant-based proteins as well, that comes from other sources. There's tempeh, there is tofu, there's other options that someone could consume to either adhere to a plant-based or vegan or vegetarian form of this diet. Once you have a protein source, then you would make up the other part of the food with fibrous vegetables, things like high fiber forms of green leafy vegetables. Let's say salad, Brussels sprouts, cauliflower, asparagus, one of these other forms of carbohydrates that's very high in fiber, because the total net between total carbohydrates and fiber tells you how much of that food is going to turn into glucose in the body.
Okay.
So the more fiber and the less carbohydrates means that you have minimal amounts of sugar that's going to enter the body, which means you need minimal amounts of insulin. The whole point of this diet is to minimize how much sugar your body is exposed to. So you also reduce insulin. So exactly to what you said, that when someone's approaching or utilizing this approach for one of many reasons, we've studied these in people with chronic irreversible metabolic diseases, to people who are also trying to, as athletes, trying to improve their, not only their performance, but also their health alongside their performance. And it's really focused on a diet that's protein focused, has fibrous vegetables in it, and the ones you typically think of as healthy vegetables, but they're usually green, leafy, high fiber, low sugar forms of vegetables. And then the fat typically comes along with things like dressings for the salad, like olive oils, macadamia oils, avocado oils, or the fat that comes along with the protein. So if you have salmon, the fat that comes with the salmon, or let's say eggs, the egg yolk. So it's a lot more simple for someone to typically follow this diet, because they're just focusing on protein and fibrous vegetables, and typically the fat is going to come along with that journey. And for people with diabetes, as you said, it can be incredibly helpful. In fact, it's well established as one of the most evidence-based approaches to control glucose and also insulin in people with multiple forms of diabetes, not just type 2 diabetes, but also the disease I have in the form of type 1 diabetes. And we've also studied this all the way to not just diabetes. We've also done studies in obese populations as well. So people with excess fat tissue. We know that when people consume these diets and they remove things like these ultra processed forms of carbohydrates, and they reduce the amount of sugar the body's exposed to, by default, people tend to consume less food on average. There's multiple studies that have shown this. And so instead of having to fight and use willpower to reduce your calories to lose weight, instead of, exerting willpower, they're actually strategically designing a diet so that it allows for less food intake by default. And that's typically going to be a much more successful diet than a diet that requires you every single day to work not to consume food.
Yeah.
That's a diet that's typically not going to be sustainable for most individuals. So, at least not long term. That's why the emergence of drugs like GLP-1 receptor agonists and others have made huge waves in the developed world, because people struggle with hunger. That's the problem. The hunger that drives them to consume more food is typically why people fail at a diet. Not because they don't want to, not because they don't try. It's because their biology and their brain is telling them to consume more than they need to maintain a healthy body weight.
Yeah.
So if you can remove foods that cause you to feel that way, typically sugary, refined carbohydrates, so packaged or processed forms of carbohydrates are the worst for this on average. And as a result, just simply removing them, because that's how you formulate this diet, is you have to remove those forms of carbohydrates, allows people to reduce how much they consume on average. And that can help a lot of people on their journey to not exert infinite amount of willpower to get to their target and goal for health.
Yeah. I see this in my clinic practice every single day. It's absolutely amazing. But we're here to talk about low carb and performance. We're here to talk about your recent study that is absolutely amazing, including you as a senior research, but all the stars that are in the study too. Tim Noakes and D'Agostino and Jeff Volek. That when I saw this, I said to myself and to my wife, whoa, that's a study that worth reading and getting in the tiny little bits of information. So before we get in low carb and performance, how did we get to this point where we have athletes using 120 grams of carbs per hour in their practice, in their training, in the competition?
Sure. So
How carbohydrates get so far, in your opinion?
yeah, so one of the biggest issues we've seen is, well, I won't say an issue. Let's actually go back 100 years. So 100 years ago, Olympians were focusing more so on protein and fat. When you looked at the foods that athletes who competed in the Olympics all the way up to the 1970s, you see that most of what was catered to them, the most of the food that ended up on their plate was largely protein and fat based. It wasn't zero carbohydrates by any means, but it was much more focused on protein and fat. It was actually in the 1960s that a very famous researcher was taking muscle biopsy, so tissue out of the muscle and analyzing it, and found that, oh wow, the muscle is storing glucose as something called glycogen, which is glucose chains in the muscle. So it must be important for energy. Well, back all the way 20 years after that, researchers were also analyzing how much the body burns sugar and fat for fuel. And what they were finding is that when they were analyzing the total body use of carbohydrates and sugar versus fat, that when athletes consume more carbohydrates, not only did they burn more sugar and carbohydrates, which makes sense, but they also tended to be able to go farther or perform harder. And so there was this belief of, wow, if glucose and carbohydrates are stored in the muscle and your body burns more of them and it seems like you're performing better, well, obviously you need to consume as many carbohydrates as you can to fill the muscle. So like, let's say your muscle tissue here, okay, or in your legs, for an average body weight female can have around 300 or more grams of carbohydrates or sugars stored in the muscle. Average body weight male, 500 grams or more in the muscle. So if you're using it for exercise and it seems like it's important for performance, then you would want to refill it as much as you can. Well, that's what most sports nutrition guidelines from 1970 to present day were doing. There was a belief as well that as you got higher and higher in intensity, that carbohydrates were also becoming more and more essential for energy, because as the intensity went up, the amount of fat use would go down and the amount of carbohydrates used would have to go up. And this was a belief because as it became more intense, the body would start to shift towards what they call aerobic to anaerobic fuel sources. So carbohydrates being one that don't require oxygen or aerobic metabolism to be actually utilized for energy. And so there was a belief that you would shift more towards carbohydrates. So not only was the muscle sugar stored in the muscle, not only would you burn more of it, but not only did you get to higher intensities, there was a belief that you needed sugar to perform at these high intensities. These three factors really caused sports nutrition guidelines to emphasize consuming 5 to 12 grams of carbohydrates for every kilogram of body weight per day for athletes, which means that an average body weight female would consume anywhere from 350 to over 900 grams of carbohydrates per day. And an average body weight male would consume 450 to over 1,000 grams of carbohydrates per day. On top of that, exactly what you said, that if you're doing long, strenuous forms of exercise over an hour in duration, they're also recommending that you consume upwards of 60 to 90 grams of carbohydrates per day, with some athletes pushing 120 to 200 grams per hour. Okay. Oh, yes, that's been reported in the Tour de France. So when you see these super high levels and they're recommended in sports nutrition guidelines, and athletes are getting faster and faster, the logic is, okay, this must be because of carbohydrates. Okay. But we actually wanted to answer that question because that was an assumption that had not actually been analyzed. So what we did is we actually tried to set up some of the most rigorous studies that we could, where we controlled the athletes' genetics, their environment. We also controlled the calories they consumed. We controlled the activity they were doing. We also controlled their body weight, and we monitored measures of the diet compliance, meaning we were looking at things like ketone levels and glucose levels continuously to ensure they were sticking to the diet. And a lot of studies had not done this. But one key other factor is that we actually also had the diet for at least 4 weeks in duration. We have known since the 1960s that the body, as it goes through changes from glucose dominant fuel to fat dominant fuel, can take at least 3 weeks or more to actually start adapting to predominantly using fat as or the metabolites in the blood don't begin to normalize till after 3 weeks. So of course it makes sense. You would at least need to do a study for at least over 3 weeks. And so we did all of that because many of the prior studies that had showed a marginal reduction of around 2% reduction in performance with low carb diets, because that had been done, were always 3 weeks or less in duration. And so we did these studies. And what we found is that athletes who were doing these performance trials, 6 by 800 meter sprints, 1 mile max effort time trial, so 1.6 kilometer max effort time trial, all the way to an athlete, a triathlete, Ironman competitors doing 2 to 4 plus hours of strenuous prolonged exercise to failure or hitting the wall. When we analyzed high carbohydrate diets versus low carbohydrate diets and controlled all these variables, we saw no reduction in performance in athletes who adhered to a low carbohydrate ketogenic diet for at least 4 weeks in duration. No difference. Whether it be sprints all the way to strenuous prolonged forms of exercise that Ironman competitors compete in. Now that really shocked us, right? Because all the sports nutrition guidelines would indicate that you would perform worse. But yet when we controlled all the variables and actually asked that question, they weren't performing worse. They were performing exactly the same as when they were eating high carbohydrate diets. So what this informed us is that athletes don't have to consume high carbohydrate diets. They have a choice in what type of diet they actually consume. Yeah. And that's important because this is about athletes having options. Okay. They can consume high carbohydrate diets if they want to, but they should also know that they can consume low carbohydrate and or ketogenic diets. And on the average, they wouldn't expect to see a deterioration in performance as long as they adhere to the diet for long enough to fully adapt to it. That's important. Our studies show at least 4 weeks in duration. Others suggest maybe longer, but nonetheless, that's important. Now, someone may ask, well, if that's the case, why would I ever do a low carbohydrate ketogenic diet? Well, maybe you're someone who's struggling with some type of metabolic issue, whether you're obese, you have diabetes, some type of neurological or mental health disorder, and you want to actually do this diet for health reasons, therapeutic reasons. Well, now you may be able to feel comfort in knowing that many studies have shown that if you adhere to the diet for long enough, it's not going to negatively affect your physical performance. But what about people who don't have these conditions? Maybe we're talking about high-level athletes who want to perform at their peak. Well, what we have seen is that when we study some of these athletes and we actually monitor their metabolism over 4 weeks, every 5 minutes we were assessing glucose levels, we would assess ketone levels over time. We were seeing that a percentage of these athletes on high carbohydrate sports nutrition guidelines were developing glucose levels consistent with pre-diabetes, a condition known to precede type 2 diabetes. Yeah. And this is incredibly important. It happened in 30% of the participants in our studies. If you look at other studies, you see that there's other studies that report as high as 60% and other studies that report as low as 0%. Somewhere, the average is probably somewhere between 10 to 30% of athletes. And probably the higher in age they go, the likelihood of their risk being higher. But what we also saw when analyzing multiple studies is that it seemed to be related to the carbohydrate intake athletes were consuming during the day. And that's incredibly important because It wasn't based on their body weight. It wasn't based on their fitness level. It wasn't age did matter, but not nearly as much as the amount of carbohydrates they were consuming in the day that predicted the elevation in glucose levels over time. So there is a potential risk for some percentage of athletes who just adhere to high carbohydrate sports nutrition guidelines without any awareness that there actually may be an inherent risk for some of them. Obviously not all of them, but some of them. And the second thing to this is, if they're not getting prediabetes, the next question is, well, then why should I do this diet? Okay, well, you don't have to, obviously. But the second layer to this is that we have analyzed this and found that on the average, there's mixed outcomes, meaning that nearly everyone adapts their metabolism the same way on a high carb or low carbohydrate diet. But the performance outcomes are diverse. Some people perform better on ketogenic diets. Some people perform better on high carb. But if all you're told is that you have to utilize high carbohydrate diets to perform, maybe you'll fit into the 50% that would have done better on low carbohydrate. And you'll never have that opportunity because you're told the only way to perform is on high carbohydrate diets. And our data consistently shows that some people perform better on low carb and some are performing better on high carb. And so this really comes down to, one, athletes having a choice in what they do, and two, that there's diversity in who's performing better on some diets and who's performing better on other diets. And so you have to try to see which works best for you.
Yeah, yeah. I as a nutritionist, I see this almost every day in my office. Somebody came here and it was borderline pre-diabetic and went to another nutritionist, sport nutritionist, and they told that you have to eat a lot of carbs. And the patient who was looking for health, looking for getting better from the pre-diabetes, got diabetic because of the directives and the orientations of other nutritionists. And as you said, now we have solid evidence that we have an option to tell our patients, okay, if you are not performing well, or if you're not feeling well with carbohydrates, you can test a low carbohydrates or ketogenic diet and feel better. Why not? And
Yeah,
yeah,
I totally agree that there's that option, right? Because one of the biggest problems is that there's a removal of autonomy or choice when it comes to diet. The amount of athletes, when we reported our findings and reported that up to 30% of middle-aged, high-level runners were experiencing prediabetes and high carbohydrate diets, I had a lot of athletes, a lot of clinicians or physicians, medical doctors reach out to me and say, yeah, this is happening to me. And I did not know that this was happening to other individuals. And I also didn't realize that diet was potentially causing this consequence. And if you think about it, what is the typical nutrition that athletes consume during exercise? They're recommended to consume very rapid forms of carbohydrates that spike glucose levels as quickly as possible, which also have some of the quickest insulin spikes possible as well. And the irony of that is that those forms of carbohydrates seem logical during exercise because you want fuel to enter rapidly. But what we also know is that these forms of carbohydrates are also the polar opposite of what anyone in the health space would recommend that people consume for health purposes, right? And so if athletes are riding or running, especially on the top end, upwards of up to 4 hours per day, and they're pounding back the sugariest and rapid forms of glucose, of like a sugar water, gels, which is basically the equivalent of sugar gel, in their diet, and they're elevating blood sugar levels and sustaining elevated blood sugar levels for hours and hours on end. And then throughout the rest of the day, they're consuming abundance of high carbohydrate based foods. For some individuals, they may run into issues. In fact, there was a well-known high-level athlete who's very public in his journey through sports, and he also disclosed that he developed prediabetes. Now, he was well known for consuming very high levels of ultra-processed forms of carbohydrates as well at super high levels. And once he discovered his prediabetes diagnosis, he went about changing that through reducing these forms of ultra-processed refined carbohydrates, and at least to his anecdotal report, improved his glucose levels almost immediately, and then went on to win a Ironman championship. And so it clearly illustrates that that athletes have options and that they should look into this and explore what their options are and what works best for them. That's critical.
Yeah. And your last study, the review that you have done, it's you completely busted the carb load myth. What do you have to say about that? Do you think that is necessary to carb load before a competition?
So much of the logic for carb loading was based on the idea that you wanted to fill glycogen pools. You wanted to fill the muscle with glycogen. You wanted to fill the liver with glycogen because those forms of carbohydrates were believed to be essential for performance. And what we found when analyzing 100 years of evidence, over 600 studies, and over 160 different sports performance studies where they administered carbohydrates, what we found is that the amount of glucose in the muscle and the amount of glucose and sugar that you burn throughout exercise is not the most reliable predictor of performance outcomes. Instead, the maintenance of blood glucose levels throughout exercise, or more specifically, brain energy metabolism, was the primary predictor of sports performance outcomes, or why carbohydrates would impact performance. In fact, when looking at over 160 different sports performance studies where carbohydrates were administered, 88% of the time when carbohydrates improve performance, the group that did not receive carbohydrates, called the control group or the placebo group, had a precipitous drop in blood glucose levels, which means that the brain was losing energy over time. And that's super critical to understand, because what it tells us is that the maintenance of brain energy is a critical outcome for performance. In fact, we've known this for over 100 years. But what we were doing is we were trying to make sense of over 100 years of evidence, but also recent emergent evidence that was clearly showing that sports nutrition guidelines focus on muscle glycogen levels or carb loading, or the amount of sugar that your body is burning as measures of performance or associated with performance. They were always associated with performance. They never had been proven to be causal on performance. That's a very distinct thing, because just because two things happen simultaneously doesn't mean that this thing over here is directly causing the other thing to change. Okay. But in order to actually analyze that, you can attempt to do that in animal studies where you, research environments where you look at, let's say, mice, rats, rodents, or other animals where you can directly manipulate genetics and other factors to actually see, okay, is muscle glycogen actually causing changes in performance? And they've done this. They've done animal studies where they actually cause an overabundance of muscle glycogen to be maximized. And what you see is there's no difference in performance with higher levels of muscle glycogen when you force it to be higher by altering this in preclinical models. But if you increase the amount of glucose that allows to sustain brain energy in the circulating blood glucose levels in the liver, you do see an improvement in performance. So actually attempting to look at the causal relationship, we see that there is a causal relationship between maintenance of brain energy metabolism and sports performance. So someone may wonder, what's the impact on this for my life? Well, what we are showing is that if someone wants to achieve performance or try to ensure they're getting performance, that it's absolutely critical to first focus on maintaining brain energy metabolism. And we know that for exercises such as resistance exercise, that less than 45 minutes of resistance exercise doesn't seem to have any impact from carbohydrates on its performance outcomes. Now, if it's sufficiently strenuous, let's say you're doing a leg workout that's a high volume of legs and it's very strenuous, full body, and it's over 45 minutes in duration, then it seems like carbohydrates may improve performance. For endurance exercise, think running, cycling, swimming, it appears that carbohydrates don't seem to have a major impact on performance unless it's over 60 minutes in duration, at least consistently. And when you are administering carbohydrates, the dose is in question. What we have showed is just 10 grams of carbohydrates per hour was sufficient to significantly improve performance on both athletes who are consuming high carbohydrate diets and low carbohydrate ketogenic diets. So it means that both types of diets, athletes, if they're doing a sufficiently strenuous and prolonged form of exercise, that having some forms of carbohydrates is beneficial. So there's a logic that used to be pervasive or common that for a ketogenic diet, you can fuel off fat, and that as a result, you never need to consume carbohydrates during exercise. But what we showed is that's not true, that athletes who are on ketogenic diets can still get reductions in brain energy. And as a result, they can benefit from consuming what we consider the minimal effective dose of carbohydrates that prevent the drop in brain energy and maintain it by just having what we showed was 10 grams per hour. There's also a question when you brought this up originally is that some athletes are pushing as high as 90 to 120 or more grams of carbohydrates per hour. And someone may ask, why? Why are they doing that? Well, we already explained that was because they believed that was helping improve things like carb loading to increase muscle glycogen levels. Or the higher the carbohydrates, the more carbohydrates and sugar were being burned during exercise. And some people believe that was very important to performance, particularly as athletes get to very high levels of intensity. But what we showed is that athletes can maintain high levels of exercise performance intensity up to over 85% of their VO2 max through sprint performance, 1 mile max effort time trials, off fat being the predominant fuel source. Wow. In fact, so we showed record levels of fat oxidation for athletes adhering to or adapting to a ketogenic low carb diet for over 4 weeks in duration. These were middle-aged runners who had done a ketogenic diet for 4 weeks. They came in, they did 6x800 meter sprints, max effort 1 mile time trials, and we actually looked at the amount of carbs or sugar their body was burning and the amount of fat their body was burning. And we pushed the intensity high enough to where we knew that the exercise intensity would be sufficiently high to where carbohydrates would be deemed to be essential or critical for performance. And the amount of fat that would be burned would be hypothetically zero. But what we found is that athletes who adhered and adapted to the ketogenic diet for at least 4 weeks were burning the highest levels of fat ever reported in the scientific literature. Some athletes were over 1.8 grams of fat burned per minute during these performance bouts, showing that fat could fuel performance at around 85% or more in performance. So that's incredibly important to appreciate because it was once believed that carbohydrates were essential for high-end performance or the higher intense forms of exercise performance that athletes will get to, especially during certain parts of physical performance, at least most. Even in Tour de France, athletes will push high levels of exercise intensity, typically north of 85%, but only for short windows of time. So what does that mean? It means that the average person, when focusing on what they should consume, these high levels of carbohydrates have been promoted, but yet the evidence is lacking to support that is actually what athletes all should do. Okay. Most of the evidence that have looked at low levels of carbohydrates during exercise or high levels of carbohydrates during exercise have not consistently shown what they call a dose-dependent improvement in performance, meaning that if you just gave 30 grams, 60 grams, 90 grams, 120, that it isn't automatically improving performance in an upward direction every time you increase more carbohydrates. In fact, there are a number of studies that show no difference between things like 30 grams or upwards of over 60 grams per hour. So what is that showing? It's showing exactly what we have illustrated in our review that looked at over 100 years of evidence, that it's about getting sufficient levels of carbohydrates if the exercise is strenuous and sufficiently long to maintain brain energy metabolism as the primary predictor of sports performance outcomes. And if you do that, it isn't reliable that just pushing higher and higher levels is going to inherently produce better outcomes. In fact, some studies show that when you push as high as 120 grams per hour, that there might even be a deteriorated or negative impact on performance beyond a certain level of intake. And that has been shown before. While other studies say, okay, maybe it is helping some athletes. And this comes down again to the individual athlete, whereas some athletes may benefit from higher carbohydrate intake. Some athletes may benefit from minimal levels of carbohydrates if the exercise is sufficiently long. But you'd never know if the only thing you do is focus on sports nutrition guidelines that tell everyone they have to consume very high levels of carbohydrates throughout their entire diet and also consume high levels of carbohydrates during exercise. But what we're showing is when you review all the evidence that athletes can have a choice and should explore this choice to maximize their not just performance outcomes, but also their health outcomes.
Yeah. Yeah, I think we got so obsessed by the calories. Oh, I'm burning the calories, and we kind of forget the deleterious effects that carbohydrates in high quantities can have in our body, like glycation and things like that, inflammation, oxidation. I think that our focus get on calories and we forgot these deleterious things. And I see this with my friends. I have some friends that are triathletes, and they say, "Oh, I can have in the middle of the train, I can have a Coke, a traditional Coke, and that refuels me." Come on. I don't think that's the way to do a sport that you are aiming for health.
Well, and I'll comment on that because I will say that I'm not here to say that you have to do low carbohydrate or ketogenic approaches.
Okay.
I'm also not saying that athletes, that high carbohydrates are inherently bad. The problem is that athletes are pushing extremely high levels, assuming that's the only way to perform, and assuming that because they're exercising, they can't get any metabolic consequences from the diet they consume. Both of those assumptions can be false. So as a result, people should be aware of the potential risk that may arise, particularly if they're pushing extreme ends, but also be aware that there are other nutritional options that they can explore without worrying about performance decrements. That is so critical to understand. And there is, you are correct, at least in my experience as well, that if you are lean, meaning low body fat, and you exercise, there's generally a belief that, oh, I can kind of get away with whatever. Yeah. And while it's true that if you have low body fat, that's protective for your overall health. And if you exercise, that's also very protective of your overall health. But it doesn't protect everyone. It doesn't protect everyone from the food environment we currently live in. In fact, there's been a major study, international study, looking at, I think, over 30 different countries, I think 34 or 36 different countries, that looked at the cause of obesity as just one measure of metabolic health. And what they found is that when looking at just the impact of diet versus the impact of physical activity, that diet explained over 90% of the obesity phenomenon globally, whereas the remaining 10% wasn't necessarily a lack of activity. It was a reduction or changes in energy expenditure, what isn't inherently a lack of physical activity. So what it's showing is that our food environment is clearly implicated in most of the major metabolic, subchronic, and chronic diseases we see: obesity, diabetes, and many others. But we also know that when thinking about things like health, even for those who are exercising and maybe normal body weight, diet can still impact them. and can still have both positive and negative effects on them. And they can't, at least based on the evidence, go through this approach and assume that they're whatever they do, that they're going to be fine. Look, exercising and low body fat is absolutely important and protective. Absolutely. But it should not ignore that other issues may arise in some individuals. Yeah. And you should be cautious, because while some individuals are so focused on performance and doing whatever it takes to perform, sometimes at a cost of their own health. And that should never be the case. It should never be the case that an athlete who is exercising at high volumes, is lean, is somehow finding health-related problems from their metabolism. That should not be the case, in my opinion. And I say this, I appreciate this quote, that no athlete's health should be sacrificed at the altar of performance. Yeah. Never. Yeah. Never, never, never. It doesn't have to be that way. Sometimes it's assumed that, performance isn't always healthy. I just can't align with that thinking. Okay. Yes, there may be moments where you push yourself to extremes, and that isn't necessarily healthy, but on the average, you shouldn't be in an environment where you're constantly unhealthy or pushed your body into places that put you in a compromised health scenario. I will tell you, it's almost certainly not worth it. At least not long term. And so a lot of people should be reconsidering this, because there's a lot of well-known athletes at the top end who've developed prediabetes. These are not one-off circumstances. We know this happens. In fact, some have developed full-fledged type 2 diabetes, explained largely, at least to our understanding, through diet. And so this is something that should be at least on everyone's awareness, whether they're a high-level athlete, someone who's just doing exercise to improve their health, or maybe they're not exercising at all and they just want to improve their health.
And Dr. Andrew, about the electrolytes, your review talk a little about electrolytes too.
So a lot of people who, when they're considering shifting onto, let's say, a low carbohydrate or ketogenic diet, one of the common recommendations is to supplement with sodium or increase the sodium intake, so salt intake from the diet. Reason being is because when insulin goes lower, because you have less sugar being consumed, insulin stores water and sodium together. So for every 1 gram of glucose, 3 grams of water plus sodium are going into the tissue. So what happens is when people go on low carbohydrate ketogenic diet, they look like they feel like, oh, I've lost 5 to 10 pounds in 2 to 3 weeks, and they look leaner. And because usually almost the most rapid impact is actually from a reduction in water weight. And so it's often recommended for athletes or other individuals to consume supplemental sodium to increase or offset the excretion of sodium that occurs when insulin is going lower and lower over time. And so it's typically for the first 2 to 4 weeks, that's highly recommended. And if some people run into issues related to fatigue or, what they call keto flu, so like a headache or dizziness, these are typically all explained by mineral loss and can be supplemented through just increasing sodium intake. If they need to, they could also consider potassium citrate or magnesium citrate if needed, but for the most part, you can get those largely through your diet.
Okay, great. And how was the reception in the sports community about your study? Do you get cheers, hates? How was that?
Well, I would say mixed. There was a lot of mixed reactions. The primary point of this review was actually to explain the biology, the physiology of the 2 pools of glucose in the body, the large muscle pool and the small muscle pool, which is the liver and glucose levels, and the large being the muscle. It was really to explain these distinct pools of glucose and how the body regulates them differently, ultimately to impact metabolism and performance. That was the primary objective. Obviously, what ended up coming out of that is much discussion around ketogenic or high carbohydrate diets, or how much carbohydrates elite level athletes should consume during performance. And I think a lot of people in the elite athlete running community have, I don't know, what I have seen is kind of a mix of curiosity and a lot of negative feedback, mainly because the feedback is, oh, these athletes are pushing up 90 to 120 grams and they're getting the fastest times they ever have. And then I would ask the question, well, if the carbohydrates were explaining it, then why, when we do the most controlled laboratory experiments to remove all the other lifestyle factors that impact performance and just test the impact of carbohydrates on performance, we're not seeing those reliable outcomes? Why is that? Why is it that when everyone talks about this, they say, well, look at the best athletes in the world. They're consuming super high levels of carbohydrates, like Kenyan runners as an example. They're consuming over 70% of their carbohydrates are from, or 70% of their calories are from carbohydrates, and up to 20% is from sugar. And they're the best athletes in the world. And then the question that was brought up is, who is the control group for these Kenyan runners? Is it the Kenyan runners who aren't as fast, who are consuming the same diet? The question, so it constantly comes back to, do you think the best athletes in the world are the best athletes in the world because of the diet they're on? Or do you think it's the training? Do you think it's the psychology they have towards discipline? Or do you think it's their parents and their genetics? Or do you think it's, some choices they make in the grocery store? Yes, nutrition matters, but no one can possibly say that it's more important than the training, the psychology, and the genetic factors that lead the best in the world to be the best in the world. It's a little bit comical for people to explain that the best athletes in the world are that way because of the amount of carbohydrates they're consuming. When the overwhelming evidence, when you really control all these variables and have sufficient time on the diet, just doesn't support that. It doesn't support that is the reason they're the best in the world. It's clearly these other variables, and diet is important. It's supportive. And that's where it gives an opportunity for athletes to have a choice on which diet they consume, or maybe how they feel during training or performance. And it isn't inherent. There's only one way to do that. But I feel extremely confident that the best athletes in the world are the best athletes in the world, not because of their diet. And many of these athletes aren't even consuming good diets, by the way. They're consuming what would be the recipe for type 2 diabetes for most individuals. Okay. So it's, I'll just stop there and say there's been a lot of feedback, but the most important thing is that people have evidence. People have science that they can look to and be educated, advance their thinking, and do whatever they want with that information. They should be informed because, for the most part, the truth is undefeated, right? You can deny it as much as you want, but what's real is what's real. Okay. And as a result, you can use that information amongst all the other information that's out there, and you can come up with your own choice on what you're going to do. But ignoring it altogether is probably not a good idea.
Yeah.
Probably not in your best interest. And put it into the array of all the other information you've gathered over time from your own personal experience, also to the experience that you've learned from in textbooks, from colleagues, from coaches, from athletes themselves, and put all that together to find out what may be best for you.
Great. What are your next projects?
So it was quite a lot, right? So we're doing a lot of research and the two ends of the spectrum. So we look at very high level elite athletes all the way to the top end, everyday athletes, but we also look at chronic disease. And so a lot of the things we're interested in is expanding upon this idea of the physiology of performance, the metabolism of performance. So we have a couple major studies ongoing right now looking at the topics that we discussed earlier, looking at the biology of what's driving sports performance in various settings. So that's forthcoming. I can't say too much to it, but just trust me, it's very important, has major implications, and directly gets to many of the questions that people have arose about our review and our prior research, and a lot of which are fair criticisms. And so we're addressing them directly with science. The best way to do it, right? You do tests and you don't know what the answer is going to be. If we already knew the answer, we wouldn't be doing these experiments. And so the things that were brought up that are true gaps in our knowledge, yes, we're trying to address those with understanding what science shows us is actually happening. So we're doing those studies currently. It'll be interesting to see the results because it certainly will advance our understanding because we're trying to truly address gaps and high level performance and metabolism with nutrition. So that's one side. The other side is we're also looking at chronic disease, the impact of how these diets impact unique diseases, or not, and also unique environments like pregnancy. So we currently have a study right now ongoing to look at the implications of very low carbohydrate or ketogenic diets during pregnancy, which is also a very controversial area that has very little evidence whatsoever as to whether it's healthy or not. Yet some women may choose to do this because maybe they have a disease like type 1 diabetes or another condition like gestational diabetes where they're concerned about glucose and insulin levels and how that affects the fetus and the child. We know that high and variable glucose levels, which are nearly ubiquitous and extremely common in diseases like type 1 diabetes, can negatively affect the baby, also the mom. And as a result, one of the most reliable ways to improve glucose and insulin control in diabetes is to reduce carbohydrate intake. So what happens if you do that during pregnancy? Well, we don't know. There's a lot of concern over what the hypothetical risk is, but there's also a clear and known risk to having high and variable glucose levels during pregnancy for mothers. And so we're trying to get at that question directly. So that's some of the experience we have ongoing. We also do a lot of research with exogenous ketones because when you go on a ketogenic diet, you have the elevation of this unique metabolite called ketone bodies. And so these ketone bodies are known to mechanistically change your genetic expression through epigenetic modifications, has an anti-inflammatory effect. It also has an antioxidant effect, and also changes key signals in the body related to metabolism across the brain, the muscle, and various other tissues. And so we're actually looking a lot at the impacts of these molecules in cognition and also sports performance settings. And so we have a study looking at things like ketone IQ, which is a product that when consumed directly converts 1,3-butadiene over to ketone bodies, along with a few other projects in the realm of just administering these unique metabolites in various domains, because we've done studies in hypoxia, altitude, in extreme environments before, and actually show that it can potentially improve cognitive function in even extreme settings. And that work was actually funded by Special Operations Command. So there's a lot of interesting areas to explore.
Interesting. And when are you thinking coming to Brazil?
Whenever I get an invite. All right. So if whenever I can get an invite. Well, actually, so our group, our team actually goes to Rio de Janeiro to see Adriano at BJJ Art Academy, and 2 or 3 times a year. I haven't been able to go yet, but they usually go sometime in the summer and sometimes near December. So either way, I hope to come. I know it's beautiful there, and it's obviously the home for the sport I compete in. So I will be there one day.
Yeah. It'll be great to welcome here in Ceará, northeast of Brazil. It's a sunny city, state, and a lot of beaches, and it's a great sightseeing and a great food too. Very traditional foods. Yeah. I think you're gonna like it.
My wife's a big fan of checking out Brazil, so someone find me a way to get there, and then I'll be there in no time.
That'll be great. Dr. Koutnik, I'd like to thank you for your time and your wisdom, and I wish you the best luck in your next studies. Your material, your studies are great to literally break some paradigms. And I think that we're doing a lot of good in the sports community.
And the goal here is just to provide information to maximize not just the health of athletes who are trying to do everything they can to perform well, but also ensure they're also healthy, ensure they're doing everything to have the longevity they deserve through the hard work they're putting in, through positive lifestyle habits, but also trying to improve people who have been dealt an unfortunate hand at a chronic disease, and how diet can oftentimes work as or more powerful than drugs or pharmaceutical interventions can, and understanding how to best apply these tools in those settings. So this is a mission that we have to try to understand that and how these tools are good, and how these tools may not be good depending on the setting. And so really science is giving us the best way to answer those questions.
Okay, that's a great mission, and I thank you for that, and thank you for your time. Thank you very much.
Right. Thank you. And hello from America to all your listeners in Brazil.
Okay, bye bye.